Hello, my name is Cristina Gonzalez along with Jordan Grant, and this is our presentation about addiction in veterans. How can addiction be proven as a legitimate disease? Addiction in veterans should be considered a mental illness by the military. Ways to prove addiction as a disease are how they connect to other mental illnesses, as well as how they affect the brain. How can addiction be proven as a disease to the military? The disease model is used to prove and understand whether or not something is considered a legitimate disease. This is used by doctors and scientists all over the world to determine the view of a situation. This model says that as long as you have an organ that gets a physical, cellular defect, and as a result you see symptoms, it is called a disease. These symptoms differ only by severity or stage of illness. The disease model strips away the nonsense about personality and social environment. With addiction, you see all of these, with brain cells and symptoms. These symptoms are prevalent in veterans addicted to substances. The behaviors and relapses are considered common for a chronic disease. Frustrating relapses are known for being related to chronic diseases. Also, most drug-related prison sentences end in relapses, so punishments do not help in the long run. Since relapses are so common in addiction, along with other chronic diseases, we believe that there should be treatment for these individuals instead of just punishment. People with mental illnesses, such as schizophrenia, are pardoned from punishment such as jail and are sent to mental treatment instead. Why should one disease get treatment, but not addiction? Like many other diseases, addiction has no cure, but it does have many triggers. Stress plays a huge part in addiction, just like many other diseases. Veterans have a huge chance for triggers, such as stress in daily life, as well as other known triggers. A cure for addiction is not available. However, the disease can be managed with coping skills. Many diseases do not have cures like addiction. The military should provide more successful treatment options for addiction. How do mental illnesses in veterans connect to addiction? Doctors have recently been prescribing addicting pharmaceuticals to veterans with PTSD and other mental illnesses. Veterans are being prescribed more and more opioids, such as Oxycontin, Percocet, and Vicodin. Healing from the traumas of war is a process that continues over years of work and needs more than a Band-Aid. These drugs do not treat the root of the problem of psychological issues, but often lead to addiction. If these addictive pills were controlled more instead of being prescribed all of the time, addiction in veterans would be less of an issue. 140,000 veterans returning home from Iraq and Afghanistan were diagnosed with some form of pain. The severities of these veterans' experience during wartime plays a major role in this statistical evidence. Mental disorders such as depression or drug and alcohol abuse were very common among these veterans. And these veterans were 2.4 more times likely to be prescribed opioid painkillers than veterans without any mental health diagnosis. Nick, an Army infantryman, was suffering from depression and other mental illnesses when he tried to kill himself with heroin. After many tragic things in his life brought about by life and the military, Nick became addicted to heroin, a deadly drug. The military did nothing to prevent this from happening, despite it being common throughout all branches of the military. He only tried heroin as a way to end the mental illnesses and pain brought about by his experiences in joining the military during wartime. How does addiction in veterans affect the brain? The brain's reward system, known as dopamine, is released when one is addicted to something and uses it regularly. Eventually, the brain's dopamine levels get so used to this addiction that it is no longer pleasurable, even though the person is still addicted. This happens to people who are addicted to something for very long until there is never enough of the substance to get the feeling as it once did. These levels become routine and ritual among the brain. This leads to more severe cases of addiction in both veterans and civilians. Persistent stress releases hormones such as CRF. CRF acts on genes for dopamine neurotransmission. People under this severe stress increase their risk-taking behavior in the search of relief. This can be in addition to dangerous substances such as drugs and alcohol. Veterans are under obvious severe stress from both their surroundings and civilian life. Dopamine is released in the midbrain whenever substances are used. Once a substance is used, and dopamine levels are high, the brain tags this item as a survival mechanism. After this, the user is unable to derive normal pleasure like they were before. The person's life becomes solely devoted to this survival mechanism. In conclusion, addiction should be considered a disease by the military due to the many facts that include it as a legitimate disease. Thank you for taking the time to listen to our video. I hope that it helps.